Hello, this is the fifth in our series of short videos demonstrating the key components of the care protocol used in the Gastroschisis Interventional Study in Ghana, Zambia, Malawi and Tanzania. This video is focused on the daily ward care of the neonate with gastroschisis. Ideally, the baby should be assessed at least every 4 hours if they are stable with vital signs that are within normal range. If the baby is unstable with abnormal vital signs, they should be reviewed ideally every hour at least, with an action taken to try and correct those vital signs each time. So what are we going to do during an assessment? First of all, a full set of vital signs. I'm going to check the oxygen saturation. I want to ensure that for a term baby it's above 94% and for a preterm baby it's between 88 and 92% or higher naturally. If not, we will give oxygen as required. I'm going to check the central capillary refill time as discussed before and the baby's heart rate. If this is prolonged or the heart rate is above 160, I will consider giving a 10 ml per kilogram normal saline fluid bolus because babies with gastroschisis often lose additional fluid from around the base of the silo, and there may be other reasons why they're fluid depleted, such as having a cannula tissued and going a few hours without maintenance fluids. Okay, I also want to check the baby's core temperature and correct that if it's abnormal. Then on to the nasogastric tube. I'm going to aspirate that as much as possible because I want the volume of fluid in the bowel to be reduced so we can get that bowel back into the abdomen. However much fluid is in the glove that's been draining plus that I've aspirated, I'm going to add those together and replace them mil for mil with normal saline or Ringer's lactate intravenously. I will also make sure at this stage that the baby's received their antibiotics and any other medication as prescribed. Now on to the bowel. I want to check that the bowel is pink. If it's discoloured in any way, I will act immediately, knowing that if I don't, the bowel can become necrotic. And there is another video detailing of how to manage that situation. I'm going to check the string of the silo is up and not dangling in the nappy. I'm going to check that the silo is suspended upright and not tilted one way or the other. I'm going to check that the gauze around the base of the silo is clean and if necessary replace that. The same for the gauze around the cord and make sure that that's wet and all the way to the base so that the cord's not drying up. If I need to change these, I'll also take the opportunity to use an antiseptic solution to clean the abdominal wall and cord to keep that decontaminated as much as possible. I'm then going to move on to feeding. I'm going to give the baby 1 ml of express breast milk every 8 hours. And if the baby becomes upset or distressed in between, they can have a breast milk lollipop, either on gauze or on a finger, to help soothe the baby. And the mother can help with those. And indeed, the mother should be supported throughout this time and encouraged to express breast milk every 2 to 3 hours day and night to ensure that she has a good milk supply when the baby comes to breastfeeding in a few days' time. Finally, we want to ensure that the baby has some parental nutrition support if it's available locally. So this can include simple amino acids, something along the lines of astamine or indeed celamine, and the celamine can be given with or without celipid if celipid is also available. Or you may go for something slightly more comprehensive such as Cabiven, which is being used in Tanzania.